goodies, I'm Granny. So today I'll be giving you 5 tips on how to get pregnant fast. It's no longer news that infertility is on the rise. Most women these days struggle to get pregnant, and it's so funny the way the whole thing works. The single women who do not actually need this pregnancy, they do not struggle. Those who don't need this pregnancy, they do not struggle. It just comes. Why the ones struggling to get pregnant, they find it very difficult. I don't know. Maybe it's because of the nature of their job or their lifestyle. Um, those there are some people also facing one or two infertility issues, and some people just decide, I do not want to give birth now in my early stage of marriage. It all depends. It varies. So if you're a woman out there, you're watching my video, I want you to know that here in this video, I am going to give you 5 tips on how to get pregnant fast. Papa, so let's get into it. Number one, it's you, this woman, trying to get pregnant. You have to understand the science behind pregnancy and conception. Yes, there are key things you should know under this um understanding this pregnancy and conception science. Number one thing you should know is that most men and women can be perfectly okay, but the chances of them conceiving is just 20 to 25%. It doesn't mean that they are not perfectly healthy. They are perfectly healthy, but the chances of these people conceiving is just 20 to 25%. There is nothing wrong with that. It is normal. In fact, do you know that a healthy couples, it can take them 6 to 12 months for them to achieve pregnancy. 6 to 12 months of frequent sexual intercourse without protection, it can take them that long to achieve pregnancy. It's not still bad. The pregnancy will always come as long as they are healthy. Another thing you should know under this science behind pregnancy and conception is you, this woman, also knowing your fertile period, knowing your ovulation day. Ovulation day is the 14th day before your next period. That is the 2 or 3 days before ovulation and the ovulation day, and also 2 or 3 days after ovulation. Those days are the days that you should be trying pregnancy. You should be trying to conceive. You should also know that the number of sex you have in a day or in a month does not matter. It doesn't matter with you, with your conception. You can have sex every day if you have the strength, it's fine, but it doesn't is not going to contribute to you getting pregnant. Pregnancy just occurs in one day. So that is why it is always good you locate your fertile days, which is your ovulation day and the 2 or 3 days before your ovulation and after your ovulation. So if you're able to locate your fertile period, you start trying pregnancy those days, you'll be able to conceive. You should also know that most women will be like, when they finish making out to their husband and some sperms, you see some sperm trickling out. It's normal. It is normal for small sperm to come out after sex. That doesn't mean you cannot get pregnant if you're healthy. Remember, we are still discussing number one. That is the science behind pregnancy and conception. That is where we are. And also, some women, after having sex, they do not want to get out of bed because they'll be like, sperm will come out. If you're done making out with your husband, get up and wash yourself. Even if you stand up or you did not stand up, if pregnancy wants to occur, it will occur. The sperm knows how to find the egg. So it is on that ovulation day that the ovaries will release matured egg that the sperm will meet to fertilize. Remember, the ovary can stay 48 hours before dying. Even the sperm stays longer than that. That is why we always say you should try pregnancy on your ovulation day. That particular day, that egg will be released, and 2 or 3 days before that ovulation day. Also 2 or 3 days after the ovulation day. Those are the period that if you are looking for a baby, try those days. Try those days. Those are your fertile period, and by God's grace, you're going to conceive. Now, let's get to number two. Number two, you're trying to conceive, but it has not been easy for you. Before you even think of conceiving, try to prepare your body for this conception. Prepare your own body. You should do your own work. Prepare your body for this conception. And how do you do this? The diet you're eating, the kind of food you're eating matters a lot when it comes to conception. Studies have shown that women that eat a lot of fresh vegetables and fresh fruits, they have higher chances of conceiving. Their fertility lifestyle is very high compared to those ones that consume processed food and packaged food. Now, fresh fruits and fresh vegetables contains a lot of antioxidants that will do wonders. They will do a lot of good work when it comes to your fertility issue. Then for those ones consuming processed food and packaged food, those food contains radicals that can damage the sperm or even damage the ovary. And also, how you can prepare your body for pregnancy is watching your weight. If you are overweight, it's a no-no. Try and reduce your weight, because overweight can also hinder you from pregnancy. Overweight can make you to become insulin resistant. It can expose you to thyroid issues. So try as much as you can to control your weight. If you're the type that takes a lot of coffee, limit it. Limit it. I didn't say you should stop. If you're a lover of coffee, limit it, because coffee contains caffeine, and you don't know if this caffeine is being made from any herb that could be an antagonist to your conception. So you limit the level of number of cup of coffee that you take in a day. Then another thing you should also know is that you do not, if you're the type that smokes, you stop smoking. Smoking is not good for a lady, especially if you're trying pregnancy. It destroys the egg. Smoking also destroys the sperm. So please, if you're a man or a woman trying to conceive, you people are trying to stop smoking. There is no you don't compromise this or not compromise it. Just stop smoking. Also limit the number of alcohol you consume in a day. And also try to exercise. Even if you can't go to the gym, do things that can make you to be active, because this is going to keep your weight under watch, and also help your hormones to flow properly. That can increase your chances of conceiving. So let's get to number 3. Number 3, you are trying to conceive. It has not been easy for you. Go for pre-conception counseling. Go and see a gynecologist. Go and see a doctor. The doctor will help to run some series of investigations for you. They will send you for some investigation like HSG. There are other ones, even scans and x-ray. They want to take history about your lifestyle to know where the problem is coming from. So it is always good that if you're trying to conceive, go and see it. Some women do not even go to the hospital. You see them going to the church, going to buy herbs and all the rest. No. Go to the hospital, go and see a gynecologist if you're trying to conceive. Number 4 thing you should know is limit stress. Stress is one of the things that causes infertility. Stress works in the brain, and when it works in the brain, it disturbs the hormones in the brain, and with this it can disturb the fertility center. You understand? The fertility progress. Then another thing is you must take vitamins. If you have not been taking vitamins, this is number 5. Place yourself on vitamins like folic acid. If you're trying to conceive, you should at least 2 to 3 months before you plan your pregnancy, start taking folic acid. Folic acid will help to limit any form of birth defects, neural birth effects, and all the rest of them. And also take vitamin D. Those are the 2 supplements, especially folic acid, that I can recommend for you if you're trying to conceive. It's going to help you achieve your pregnancy. So these are the 5 tips I have for you. Do this, and after you have tried it, let me see your comments in the comment section. Bye for now.